If you are under the age of 65 and already collecting Social Security benefits, this message is for you. Because there is a transition coming that most people are never warned about. It happens automatically, it happens quietly. And for a lot of people, it creates serious financial exposure before they even realize what's happening. That's exactly what we're talking about today. Now, whether you're turning 65 next month, later this year, or even a year or two down the road, this applies to you, so please don't tune out. Now, let's talk about the transition itself. If you are collecting Social Security benefits before age 65, here's what happens. When you turn 65, you are automatically enrolled in Medicare Part A and Medicare Part B. For some people, that sounds simple. And you might be thinking, I already knew that. That's great, but here's the part many people don't fully understand. About 3 to 4 months before your 65th birthday, Medicare will mail you a packet. Inside, that packet will be your Medicare card and information about your coverage. So if you're approaching 60, a lot of people assume Medicare pays for everything. It doesn't. And this is where people get blindsided. Medicare Part A covers hospital care. Most people know that. But Medicare Part B is where the real exposure is. Part B covers outpatient services, doctor visits, procedures, tests, the care you actually use most often. Medicare Part B pays 80% of approved costs. That sounds good, but here's the key question. Who pays the other 20%? You do? Let me put that into real numbers. If you receive medical care that costs $1,000, Medicare pays $800. You're responsible for the remaining $200. Now scale that up. If you have a procedure that costs $10,000, Medicare pays $8,000, you're responsible for $2,000. That's not an exception. That's how the system works. And this is the moment where many people realize they were never fully protected. This is the gap. This is what catches people off guard, and I want to make sure you don't learn this the hard way. Now, once you're enrolled in Medicare, you have choices. You can stay with Original Medicare, also called Traditional Medicare, or you can choose Medicare Advantage. Those are the two paths. If you stay with Original Medicare, you also have the option to add a Medicare supplement, also known as a Medigap plan, plus a Part D prescription drug plan. These additional plans are designed to help cover that 20% Medicare does not pay. So instead of you being exposed to large out-of-pocket costs, the insurance company absorbs most of that risk. You may still have copays or deductibles depending on the plan, but your financial exposure is significantly reduced. The other option is Medicare Advantage. That's Medicare Part C. These plans are offered by private insurers but approved by Medicare. They bundle your coverage together and generally include additional benefits. Now, I'm not saying one option is better than the other. What's best depends entirely on your personal situation, your health needs, your doctors, your medications, your budget. That's exactly why this can feel overwhelming. There are thousands upon thousands of Medicare plans available across the country. Supplement plans, Medigap plans, Part D plans, Medicare Advantage plans. We're talking tens of thousands of options. Trying to navigate that on your own is confusing for almost everyone. And that's why I partnered with Chapter Unicolumn for free. Spend as much time as you need, ask every question you have, and get guidance from someone who does this every single day. They help you compare plans in your local area and figure out what actually makes sense for you. Now here's the key takeaway. If you do nothing, if you simply rely on Medicare Part A and Part B, that 20% gap stays on you every time. But if you choose additional coverage, whether that's a supplement plan or Medicare Advantage, that burden shifts away from you. It goes to the insurance provider. Your out-of-pocket costs become predictable, and in some cases, dramatically lower. That's the protection people don't realize they need until it's too late. Now, could you try to figure all of this out on your own? Yes, but I wouldn't recommend it. There are too many variables, too many plans, too many fine details that can cost you money if you miss them. That's why having someone guide you through this is so valuable. And again, Chapter does this at no cost to you. I partnered with them after helping my own parents transition into Medicare. It was stressful, was confusing, and honestly, it was a mess. That experience is exactly why I wanted a trusted resource for this community, because so many of you are Social Security beneficiaries, and so many of you are either already on Medicare or approaching it. So let me bring this full circle. If you are under 65 and collecting Social Security, remember this. About 3 to 4 months before your 65th birthday, your Medicare card and packet will arrive in the mail. When you turn 65, you will be automatically enrolled in Medicare Part A and Part B. From there, it's up to you to decide how you protect yourself from the 20% Medicare does not cover. And the easiest way to do that is by getting help from someone who understands the system. That help is available to you for free. I hope this clears things up. If this helped you, please consider subscribing. And if you know someone who's approaching 60, it could save them a lot of stress and a lot of money. Until next time, take care, and I'll see you again soon.